Of course, every new mother thinks, I'm gonna take my baby in for acupuncture, right? This is a time when we are very nervous about what to do with our little ones, and so acupuncture is not the first thing that most new parents think about. We don't typically do a lot of needles with babies that are this young, but what we will do is acupressure. And acupressure and herbal supplements work incredibly well for babies this age, whether they're nursing or whether they're on solids. This is a great time to start your holistic journey with your little one. With this little one, we have a little bit of eczema that we're gonna work on. And with a lot of kids this age, the thing that we work on is colic. She's getting a little bit older than the colic age, but digestive disorders, things that we want to help move. We wanna keep their bowels moving. That's one of the most important things you can do for them. Most challenges at this age stem around digestive insufficiency. Their digestive systems are being built, their immune systems are being built. Being able to work on that system is the first place we look. And so that's what we're gonna do today. I'm literally just gonna take my fingers, just cleaned, so everything is good to go. And we're just gonna press, and I'm just gonna push my finger in a little circle around this point here. This is the command point for her digestive system, and it just feels like a little baby massage. You know, that's all this really is. Now, depending on how good they are and how how well they handle the pressure and the new person that's kind of working with them, then we may take a small pin and put it in. If we do pins in a baby, we usually take it out right away. We don't leave it in like we do with adults. Their systems are changing so fast and they're so dynamic that all they really need is a stimulus at that point, which is why often just putting my finger here and rolling it around is sufficient. So, as you can hear by her cooing, this is clearly having a positive effect. All right, so that is one of the more common things that we'll do is all these points are around her lower legs, maybe some points on her lower arms, really easy spots that we can do. When it comes to things like eczema, then we will, a lot of times we'll do these kind of brushing motions. So you're trying to get a clearance through the body. That little bit of brushing, that little bit of movement, and we teach parents to do this also. You know, when it comes to something like a skin issue, just brushing their arms like this is extremely effective for getting things to move. Yeah, don't be shy, just get in there. Yeah, get in there. There you go. And it'll usually get a little bit red when you're doing that, when you're brushing, doing like a brushing technique. This is essentially creating movement throughout an entire acupuncture pathway. With babies, you don't need to hit specific points, you just brush the whole general pathway because that pathway is really developing. And so you can hit the entire thing at once and have a big effect. So one of the most common things that we'll see babies for is constipation. So being able to get their bowels moving is really valuable. So what we're gonna do is just press into her abdomen, and this often will get the bowels moving pretty quickly. So you just wanna be aware of what you're doing here. Now, if this doesn't do the trick, we can use pins and we can see if that adds a little bit more to the stimulus. But this is often all that we need, and the babies really like it. I'm putting my finger in just till about the knuckle here. And so parents that are out there, this is something that you guys can do with your young children, especially if they have a little bit of limitation with their bowel movements. First, we're gonna do a quick little swab of the spot. They'll get used to that as they get older, so you be very quick with that. And then, as usual, we take out a new pack. The points that we would use with a little baby are the same that we used in the ear for an adult. Really, really tiny, tiny needles. Mom is having lots of fun with her, and what you'll see is we just try to kind of go with the movements here. Don't try to get her to slow down. We just kind of wait until we get a good spot and then tap it in. And then boom. So that's in, she's smiling, and then now it's already out. She did a fantastic job. This is exactly what we typically see with babies. They barely even know that it happens. And so it's a great way to start getting them into the holistic world as it relates to their health and wellness.